Hello everyone. In this YouTube series, I want to talk about a simple and effective clinical procedure to treat erectile dysfunction. It will be 3 or 4 parts altogether, to explain the theory behind the technical aspects, and finally featuring further discussion with question and answer regarding this clinical procedure. This series of YouTube is mainly for medical and dental professionals, but if you as general public find it interesting, please help yourself and just enjoy it. Now, let's talk about this new but old and simple but technical procedure to overcome erectile dysfunction. In these days, PDE5 inhibitors, such as Viagra, revolutionized the treatment of erectile dysfunction, which increases blood supply to corpus cavernosum of penis, and it is the first choice of treatment option in erectile dysfunction. Also, in some very serious cases, surgically inserted inflatable implant is available as a treatment option. In fact, before the age of PDE5 inhibitors, simple mechanical devices, such as penile expansion pump and cock ring, have been used commonly alongside with psychological support. One day, I was wondering whether there would be any simpler way of helping erection other than taking drugs like Viagra. Somehow, one of old method inspired me. Before we go any further, it is worth revising the physiology of erection. After some sort of sexual stimulation, blood supply increases as the smooth muscle surrounding deep penile artery relaxes. PDE5 inhibitors acts on this level and maintains increased blood supply. Increased blood supply fills the corpus cavernosum of penis, and this leads to putting pressure on penile veins so that the blood drains less and total retained blood volume increases, which leads to erection. In other words, it is a mathematical function of blood supply and drain. PDE5 inhibitors are all about supply. However, the procedure I want to talk about is all about drain. Both have the same end result, which is the increase of retained blood volume in corpus cavernosum, leading to erection. Now let's look at the anatomy briefly. The anatomy we are interested here is dorsal veins, corpus cavernosum, with deep artery and urethra. During erection, inflated corpus cavernosum puts pressure on veins, especially dorsal veins, which are the major veins draining blood from penis. Especially superficial dorsal vein is located very at the surface of penis, and it is readily palpable so that we can manipulate this vein very easily. Also, it is worth paying attention to urethra and its surrounding tissue. This surrounding tissue is very thick and elastic. The procedure I want to talk about is all about how to manipulate this major vein externally and how to control blood drain to enhance erection. I want you to look at the erection process from blood drain perspective through dorsal vein. That is, as long as we can slow down blood drain through dorsal vein, erection can be achieved. That means intentional dorsal vein manipulation can have the same effect as PDE5 inhibitors, which works on artery. Since the dorsal vein is palpable, gentle external pressure on dorsal vein slows down blood drain drastically and helps erection. As I mentioned earlier, so-called cock ring or erectile dysfunction ring is based on this principle. It has been used for a long time in the past and still is used. Also, it is readily available in internet shopping. However, it has inherent problems. It is not anatomically designed. That is why it causes discomfort and pain to use during intercourse. Also, it tends to put too much pressure around penis, and it may cause unwanted results such as poor blood circulation, numbness, and in worst, thrombosis. However, if we can make a ring fitting individually and just putting pressure on dorsal vein gently, it can overcome all those problems of cock ring. This custom fit ring, I will call it dorsal vein constrictor, or shortly, vein constrictor, is far more painless and more comfortable to wear compared to ordinary cock ring. Since it is custom made, it will cost more than ordinary cock ring. However, it is relatively easy to make one. I think it will be more economical than taking PDE5 inhibitors in long run. Unlike PDE5 inhibitors, its effect is spontaneous and it can be used safely with most of medical conditions, except for skin allergy to acrylic material, which is very rare. I have to admit that PDE5 inhibitors has wider indication than dorsal vein constrictor. It alone is effective only in mild case of erectile dysfunction, that is, it works best when a man can achieve a partial or full erection but has difficulty maintaining it. In moderate case, it can be used together with PDE5 inhibitors. When they are used together, they have synergic effect. For example, if you come across a patient who gets erection with PDE5 inhibitors, but not getting enough rigidity from it, dorsal vein constrictor can be used with PDE5 inhibitors to improve rigidity. For severe cases, it is not certainly indicated. Now let's talk about the fabrication of dorsal vein constrictor. Making dorsal vein constrictor is slightly technical, but it is very simple enough for medical and dental prosthetists and technicians. For medical doctors, I strongly recommend you to get advice or seek help from them. It is a piece of cake for them to make a small plastic ring like this. I will talk about technical aspects more in detail in the next episode. In this episode, I will briefly explain about the clinical procedures. Firstly, you have to examine the patient, taking medical histories, and so on. Dorsal vein constrictor is only suitable for those with mild to moderate erectile dysfunction. After examination, if you decide to use a constrictor, impression of patient's penis is taken. If you look at the impressions, you will be very surprised how different they are from each other, and understand why non-anatomical cock ring can cause so much discomfort. Once you have impression will be processed and constrictor will be fabricated. Let's say you made a constrictor and ready for issuing. You issue the individually fabricated constrictor and have to check how it is fitting, and follow up the patient regarding erection with some adjustment if necessary. I have had some successes, also some failures from this procedure, but it was worth trying since it is so simple and safe. I strongly recommend you to try this on you or your partner first to get some first-hand experience, and if you feel you are confident enough with this procedure, you can prescribe one to your patient. In the next episode, I will explain more in detail about the practical aspects of dorsal vein constrictor. Thank you for your attention. Hope you enjoyed this YouTube